As you all know, Hippocrates, it was way back, and that's the father of modern medicine. And even he, at the end of so many years of studies, he concluded one thing, that perhaps gut is the most important thing in your whole body. And that in fact, most of the diseases begins from the gut. And in fact, he said that a bad digestion is the root of all evil. And if you look at the gut itself as a whole, I'm sure for those science students, and you would recognize this structure, and it's very important, of course, for medical students to be able to draw that picture. Otherwise, you will not be able to pass the exam. And if you look at the gut as a whole, you can recognize the stomach, the small intestine, the large bowel. But you must look at the whole structure itself. And because a lot of people actually forgot that the gut itself is actually an organ. And in fact, it's as important as your heart, as important as your kidney, and your lungs as well. And in fact, most people don't actually talk about gut failure. In other words, when your gut is not working well, you hear people talk about heart failure. Your granny has a heart failure and the leg becomes swollen. But never you heard anyone that talk to you about, oh, my gut fails. What happened to my gut? It seems that a lot of people are not aware that in fact gut failure is very important. And if you look at the PubMed, it's a marvelous tools. Any public can actually go onto Google and then go to this website, PubMed, and then put in your search word and all the scientific paper will come out. And for those who may not want to look at individual papers, you just look at the number of papers that you publish. And if you see in 2000, from 2009, when I first began looking at this, and now it's 2016, it's been a long time since I've been looking at gut failure as a research subject. And you can clearly see over the years, the number of interest in the gut failure itself is actually not huge compared to heart failure or kidney failures. And this is, we are talking about scientists, among medical profession, not to mention among the public. So, if you look at the gut, who actually lives in our gut? Is it Earth that lives there, or is it somebody that lives there? You can imagine that if you look at your body, for those who does meditation, right, you'll be mindful of your own body, and then you look inwards on your body, and you just wonder, oh, actually, I have a mouth, I have an esophagus, a pipe here that go down, and then I have a stomach that hold my breakfast, and then from there it goes to small bowel, and go a long way down the way, and then, oh, I think you'll go to the large bowel, and then out it went. This morning I have a poo, right? So come out. So if you think about that, actually, just imagine yourself an organism or a bacteria or microorganism that start to crawl into your mouth and then come up from the other end. It's just like aliens, isn't it? You actually can enter a human body just like going to a space and then come out through the other side. What I'm trying to say is that, in fact, inside your body, there's another space that is completely external. That is not even within your body, if you talk about that, for the organism or bacteria that go inside your body. And this environment is utmost important. Just like your skin that breathes the air, inside your body, you have a long tube that also breathes the air, and inside that part of the body is a very long way that expose yourself to a lot of dangers, to a lot of foreign insults that might incur diseases to your body. And that's why Hippocrates said, all diseases begins in the gut, because this is where you are exposed yourself to a lot of harmful things in this world. So, if you don't believe me, just think about when you're a baby inside your mom's womb. Your gut's supposed to be sterilized. There's no bacteria there. It's completely no bacteria, because you were still inside the womb of your mom, and that you're not exposed to the environment. But the moment when you come out through the vagina, then suddenly your body exposed to the bacteria in the vagina. And that bacteria then start to go from the mouth into your stomach, into your small bowel, into your large bowel. And then when you come out to the world, then all the bacteria that you breathe, that you eat, that you swallow, you virtually have to be like a Buddha. You know, look at the water. Actually, a lot of bacteria there. You know, and you drink water. There's a lot of bacteria there. A lot of things that you cannot see that actually you consume every time. You have the milk from the mom. You suck the milk, and within that, there are bacteria as well. But the difference is that are those harmful bacteria, or are those useful bacteria that will help you to grow? You need bacteria to grow. So in other words, us as a human being, actually we have been for centuries, ever since you were born, you are living together with bacteria. You are a friend of bacteria, and bacteria are your friends too. And you help each other to grow. And there's a lot of scientific evidence in that. And in fact, if you count the bacterial cells in your own gut, from the mouth to the anus, there are much more bacteria than your own body cells. Do you know that? And initially we thought that it's 10 times more. But I think now we are getting to understand more, and we think that perhaps it's about 3 times more cells or bacteria in your gut than your whole body itself, including all your cells in your head, right? So there is a huge number of bacteria that you are living with. So if you look at a healthy gut, and if you think that you are healthy, your stomach should contain this bacteria. And of course, we all know that Helicobacter pylori is not supposed to be there. But nature is so interesting. We now know that Helicobacter pylori, this bacteria, if it lives there for a long time, it can cause an inflammation of your stomach. So you get stomach pain. And if you have that for a long time, then you get stomach cancer. And we know that. So when we learn about it, then we start to eradicate that bacteria from our stomach with antibiotics and triple therapy. We say 2 antibiotics plus 1 acid suppression medication to eradicate this bacteria. And following the eradication of this bacteria, the stomach cancer rate coming down, right? And you thought that that's excellent. We've done a great job. But to our surprise, we now know that although the stomach cancer going down, but this part here, where is the junction between the esophagus and the stomach, the food pipe and the stomach is a reservoir. At that junction, there's a cancer. And that incidence has risen, become much more common. And we look at the history, and we found that that started when we start eradicate the Helicobacter pylori. So now we just wonder whether by eradicating the bacteria from the stomach, we reduce the stomach cancer here, but however, it seems that by nature, the bacteria actually protect us from having cancer here. So by eradicating the bacteria, potentially we could have caused more cancer in this region, which is a much more difficult cancer to treat. So what I'm trying to say is that we live in a world that is very interesting, that we have friends, and we just have to know who are our friends before we eradicate them. And when you move downwards, I would like to highlight to you that at the top part of your gut, the colonius bacteria is lactobacillus, and because they can survive in the acidic environment of your stomach. And if you move further down, and further down, you can clearly see that from here, you probably get about 10,000 of bacteria. But as the more you move further down, then you can see that you get more bacteria, to 10 of millions. And if you move to your gut, the colon, then you can see that there's a change in the types of bacteria that you have. You have bifidobacterium. So it seems that even your own gut have a preference of the type of bacteria that your gut will prefer. So this is very interesting. And you look at what kind of function does this bacteria has. And you can clearly see from this chart that there are quite a lot of different functions. And for those engineering students, you wonder what do you mean by gut-brain axis. Well, I'm sure before your exams, you get very nervous, right? And I'm sure before this talk, I got very nervous too. And when you get very nervous, what happens is that your brain will tell your gut, and your gut get a bit nervous, and then you get a bit of wind in your stomach. That's what you describe, right? A lot of wind, a lot of butterflies, you know. And then you go to the toilet a little bit more often. You may rush to the toilet before your exams, feeling really feel like want to go, but when you go to the toilet, nothing come out. And you go back to the examination hall, sit down, and you still feel like, I want to go, but you know that nothing come out. So it seems that your brain and your gut has a connection. And in fact, there is a syndrome called functional bowel disease, irritable bowel. I'm sure you all know that you got this funny pain in your stomach. You went to a doctor like myself, and then you get examination, top right, bottom, and then there's nothing wrong. Then the doctor say, oh, there's nothing wrong with you, but surely your gut is a little bit sensitive to your mood. Why don't you go and a cup of peppermint tea? Why don't you sit down, relax, and your gut will become much happier? Why don't you go for yoga? Why don't you go for meditation? Why don't you go and do something that's good for your mind, and then your gut will become much happier? That we all know it does happen. On the contrary, surprisingly, the scientific studies now show that if the microflora, the bacteria in your gut is not happy, you also become unhappy. So that is interesting, isn't it? Which means that your body has a lot of bacteria, and if your if your bacteria friends are not happy inside with the environment that they live in, just imagine that the porters, they squat there and then they're not happy with the things that they have, then they protest, and then your brain then start to go a bit haywire, and then you get a bit unhappy, and it seems that you can have depression from that. So, in other words, when you're feeling depressed, when you're feeling a little bit unhappy, maybe you should also look into your gut. Is your gut alright? Are you having some harmful bacteria in your gut that make you so unhappy? And that is very interesting. And it seems that our human body do react in such a way. And this is what we call gut-brain axis. And of course, immune system. I'm sure for those who has some sort of skin disorders before, eczema, anyone knows about eczema? A bit itchiness in your skin, and you wonder, why do I have this eczema when you were a baby, when you were young, especially for those who are, young adults? Then your mom will say, it's okay, you will grow out of that, when you get older, your eczema will disappear. And you all hear about that. But what if I tell you that if you improve your bacteria that grow inside your gut, and that itself actually can improve your immune system, and that itself can actually improve your skin disorders. Because a lot of eczema are allergic reactions, right? A lot of irritants. And it seems that by just manipulating your gut bacteria growth, that your skin, which is so far away from your gut, is the other side of the world, right? From inside your gut to the outside, the other side of the world, the skin. And it seems that they can still be interconnected. So that is how marvelous this is. And of course, you have metabolism, certain nutrients that you want to absorb, but you cannot absorb because you don't have the right bacteria. So all these bacteria are very useful. And if you don't believe me, let's look at this one. If you look at the mechanism of the pathway of how the little bacteria that you cannot see with your naked eye can actually play a function in your whole body. Wow, this is complicated, right? For medical students. Is it complicated for you? It's complicated for me. But let's look at this perhaps in a more simplistic term. Alright? I want to bring you to this. This is a very nice graph. This is your cells, and the green one are those friendly bacteria. Okay? And the red one are those unfriendly bacteria. Those who are going to make you sick. And you can see that. Have you heard about competition? Everyone heard about competition, right? So basically what the nature decided is that I would send in a huge army of friendly bacteria, like China. They have so many army officers, right? You send them all in, and then they come to Malaysia. There's so many of them, all right? And first thing they do is that they take away all your food, all right? So these friendly bacteria will colonize the cells, and then they take away all the food. So those unfriendly bacteria, which are smaller in numbers, will then cannot compete because of the sheer number. So they become starved of food, and the bad bacteria then die because they don't have food. And also, because of the sheer number, they occupy the important, we call the receptors on the cells. So bad bacteria cannot find themselves attached to the cells, so in the end they die as well. So this by exclusion. So when you want to have your gut to have a good bacteria flora, the first thing you look at is how many bacteria can I send in, right? So when you take your nice, useful bacteria, the number of bacteria that go in must be huge. In other words, you want to colonize your gut with the useful bacteria. Then the harmful bacteria will disappear. This is very true. When I first came back from United Kingdom, and for some reason I decided this is the best part of the world for me to live. So I returned, having lived in UK for 24 years. So my gut is a little bit like angmo, you know, because I take fish and chips, you know, well, not much curry there, unless you go to Manchester, you get a lot of Indian curry in Manchester. It's a curry city. But other than that, my gut is a little bit like the Caucasian, you know. So first thing I know when I come back to Malaysia is that I go outside to eat char kway teow, I come back, then I will sit in the toilet. You know, it was quite a problem, in fact. So one day, I was so sick, and I couldn't go to work because I'm having this. And then a friend of mine, whom I met in the hospital, who actually sell these probiotics. So she called me and said that we are supposed to have a meeting. I said, sorry, I couldn't go to work. I'm having a very bad diarrhea. Then she said, do you need probiotics? Then I thought, when I was in UK, we did some studies on those patients with diarrhea, and we found that rather than treating with antibiotics, we gave them yogurt, you know, and it seems to work. So certainly, I do believe in having probiotics. So I said, yeah, why not? But I'm at home. Anyway, she sent the friendly bacteria to my house, and within 2 days, I can't believe it, my diarrhea has settled, you know. Then after that, wherever I go for my trip to China, to Korea, to Japan, to any other country, to Myanmar especially, I will make sure inside my luggage I carry my probiotics. Because you know when you go to a different place, the bacteria are different, and your gut may not be able to adapt to that, so you have to call in your good friends, you know, just pour in your friendly bacteria, and it might work. So, it is just by sheer number of bacteria, but more importantly, they also can manipulate the local environment of your cells to improve the pH, for those engineering students, the pH of your body, and also they help to tighten up the cells so that they don't leak. You know, you look at your skin, it's beautiful skin, but when you get older, it becomes wrinkles, right? And same for your gut as well. Inside, you got another skin that protect you from the external harmful environment. And if that skin becomes leaky, in other words, have a lot of holes, then you're more likely to have those poison that might get into your body, isn't it? So those skin must be well controlled, tightly controlled. The cells must be tight so they don't get opened up and get all these poison that go through and get into your body. So that friendly bacteria apparently helps to tighten that up, what we call the tight junctions, right? And now come to this marvelous thing here called the immune system. You look at this, the Th1 pathway, Th2, T regular cell, antigen presenting cells, and all those are very complicated cells in our body that help us to fight against cancer, to help us to fight against infection, or anything that is foreign. Of course, sometimes those cells misrecognize your own cell as foreign. It's when the things start to have disease, that your own cells are attacking your own cells. It's called autoimmune disease, right? So, those cells that you have in your body, those that protect you against cancer, against any infections, in fact, that make you what you are now. Otherwise, you will die because you are living in an environment with lots of things that can make you sick. Those cells are important. And apparently, these friendly bacteria help to make those cells good. It helps them to regulate itself. It's fine. When you take probiotics, your eczema improves because it helps those immune cells to become better. So it does have a good effect on our immune system. So it's like a synergistic effect, you help each other. And of course, we also know that certain receptor cell that seems to help us to dampen down our inflammation in the body. In other words, if you have any inflammations, that for whatever reasons, infections or injury or anything, or your gut having an infection and become very red and hot and very angry looking, that those bacteria can actually help to suppress that. So, looking overall, have you ever seen a single drug that can do so much wonders? Not right? But these are not drugs. These are the bacteria that when you are born, you are meant to live in harmony with them. That is your friend. You can say it's God's creation. God's give you bacteria to live together. So, of course, without a healthy gut, as I said before, that everything will just fail. Your body would have all sorts of problems. You have diarrhea, constipation, you have cancer, you have all these systemic disorders, skin disorder, or even if you take too much antibiotics, which is now quite commonly, you've got a bit of common cold, you go and see your GP, your family doctor out there, they will say, okay, these are antibiotics, just take antibiotics and you'll be fine. But in fact, by taking antibiotics, you destroy all your good bacteria in your body, and in fact, you get more sick. So, in fact, if you have a viral infection, you do not need to take antibiotics. Your own body system should recover. And this is the gut-brain axis that I told you about. It's truly scientific. We now know that it's not a myth. It's not like sincere that say that, if you are not happy, your gut also not happy, but it's scientific based, as you can see here. Just imagine your gut like in a pond, with a lot of fungus. If your fish pond is so dirty, your fish is getting very unhealthy, right? So you have to give oxygen, you have to clean out your pond and things like that. So just imagine this is your gut. Of course, sometimes our gut can become dirty also because of the food you take, where you have been. So now and then you have to think about how to clean this up. And this is a very important chart. I found very useful. It comes from Bristol in England. Okay? For those medical students, you get asked on this. Okay, if I see you in the exam, I ask you this. Alright? This is our secret. What do you mean by constipation? When you ask someone, are you constipated? And how do you know that someone is constipated, right? Unless you actually examine the stool. So you need to have a description. So what we normally say is that if you have separate hard lumps like this, that you become like a goat dropping. You see the goat, right? You follow the goat and you see it dropping on the ground. It's like that. Little biji, alright? Okay? And then you have a little bit like a sausage. And a normal one, this morning if you look at your own feces, is that it's a little bit like a sausage, but it's smooth and soft. Okay? This is perhaps a bit like German sausage. Too big, too hard, right? This is softer, it's normal. And if you have diarrhea, then it becomes very watery and splashy, It's not very nice at all. So this is how you describe your stool. But people can do anything to make the stool look like something, right? If you walk around your supermarket, you see someone say, if you have gallstones, you know gallstones, right? Batu here, gallstones. Take these medications, this herbal thing, and then you can pass out the stones, right? It's wonderful. When I heard about this, I thought, Prof, I'm out of job, no more gallbladder for me to remove, And in fact, one of my medical secretary in UM came to see me, and she was on my waiting list for this gallbladder surgery, the keyhole surgery, and she brought along her own thing and said that, Prof, I have taken this medication, and now I pass out my stones. Look, my stones are on your table now, right in front of me, Then I look at the thing, I said, yeah, it does look like gallstones, it's a bit green, It's, it's round, it certainly looks like stone. What would you do when your patient do that to you? Are you going to say, oh yeah, you really pass out the stones and no need surgery? Or you say that, oh no, I don't believe you, take it away. Being a very mindful person, I did something very simple, right? I look at the stone, and I study the stone, and I said, well, this stone looks round, it's green in color, I didn't manage to smell it, right? But I put on a pair of gloves, and I press on it, and I scratch, flatten. Then I show it to her, I said, this is not stone, this is your feces. You are constipated because of the medication that you take. You purposely make your stool constipated, and that you make you think that you pass out gallstone. So that's why a stool chart is very important, right? So now I'm going to give you a secret. Please pay attention, because for the next few minutes, we have a little quiz. If you answer the right questions, or you voluntarily say the right questions, you got a gift of life, right? Okay? You want that? Alright. So, what made your bowel unhealthy, right? Anyone look like that here? Lie down, not doing anything, watching football. Yeah, now is a good time watching football, right? I do that as well at night, Your lifestyle is very important. Your habits, I just did a hemorrhoid surgery for my patient yesterday. I look at the bowel, I said, this bowel is not normal. It seems like the bowel trying to come up together with the feces, It's called prolapsing. And the first thing I think is that my patient must be, either reading a book in the toilet, right? Some people like to do that, right? Sit on the toilet, nothing come out, but still sit down and read, or iPad, or play with your phone, messages, right? And you say, oh, I on the toilet for half an hour, nothing come out. But the fact that you sit on the toilet, naturally your body will try to zoop, right? So in the end, your bowel will become unhealthy because you have a habit which you're not supposed to. You're supposed to go there, empty your bowel, and you go. Don't go and sit down and study, right? It's not good for your bum. So habit is very important. Food, what kind of food you take, the donut, right? And KFC, right? Kim Fa Chin, right? So all my patients in UK, they've got a Mr. KFC at the top of the head, all right? So it's called KFC, unhealthy food, right? I'm a vegetarian now. Psychology, right? Overwork, overstress. You need to take time out to relax, okay? Don't be like that. Don't take too much medications, right? Unnecessary. And of course, if you have other illness, then your bowel will get unhealthy as well. Aging, as you get older, your gut become less good. But in fact, I now believe that if you be friend with your bacteria, and more friendly bacteria in your body, it's more likely that you are less likely to age, right? For senior citizen here, right? If you take probiotics, you're less likely to age. I think there's evidence for that. And laxative abuse, for those who take drugs to make yourself go to the toilet, think of an alternative way.